watching CBS 2 News in high definition.
Liposuction is the fourth most common cosmetic surgery procedure, with more than 200,000 done this year alone.
And we know it can make you look better, but could it be actually good for your health? Our Dr. Max Gomez says that's what a new study suggests. Is this true, Dr. Max?
Yeah, well, it could be, not just good for your health, but maybe good for your heart, at least indirectly. Liposuction takes a pound of fat or a pound or two of fat out of the body, and it turns out that getting rid of even that small amount seems to lower certain fats in your blood that are bad for your heart. Like a couple million people before her, Susan Jurisco had a few problem spots on her body that just wouldn't go away, no matter how much dieting and exercise she did.
I've had muffin tops. I had inner thighs and outer thighs done.
Done means Susan had liposuction to get rid of those resistant fat pockets. Before each one, she had a routine blood test, and lo and behold, there was an important change between the first and second liposuction, which were about 18 months apart.
Triglycerides are 68, a 46% reduction, and her white cell count down to 5.61 from 6.95, almost 7.
Triglycerides are a kind of fat in the blood that some studies say are as important as bad cholesterol in predicting heart disease risk, and white blood cell counts are linked to inflammation and diabetes. Susan says she hadn't changed her diet or exercise program or started taking any medication.
Absolutely, very pleasantly surprised.
Could this really be due to liposuction? According to a study presented at the American Society of Plastic Surgeons conference that measured blood and cholesterol in more than 300 patients before and after undergoing liposuction, patients who started out with elevated triglycerides experienced an average 43% reduction in triglyceride levels after surgery, about twice what you get with medication. White blood cell counts also went down, but only 11%.
We used to think that the fatty layer was a very inactive organ. Now it appears that it has a lot of effects on the body's metabolism, hormonal levels.
So I may come back and see what else I can have done.
Now, no one is suggesting that you go get liposuction to lower your risk for heart disease. Think of it as an unexpectedly positive side effect. And remember, liposuction is still surgery and needs to be done by experienced board-certified doctors, because there have been some liposuction disasters when it's done by the wrong people. Maurice?
Not something we were considering until now, Max.
True.
Thanks so much, Doc. Well.